Hey SVS Imaging Tribe, Dr. Fred Gromalak here. We're going to highlight how to distinguish left adrenal gland from lymph nodes, and commonly in the region of the left adrenal gland is going to be your periaortic lymph nodes, but they can look very similar to an adrenal gland. So let's take a look here in this patient. So let's just identify what we know first. Certainly right here, we're able to pick up our left kidney, okay? From there, as we scroll through, we're picking up this structure here, which resembles the shape of an adrenal gland. It's also medial to it, so fits that, could this be representative of the adrenal gland? And then here we have our aorta. We know the left adrenal gland lives between the left kidney and the aorta, but I'm not convinced as we play this that this structure right here is our left adrenal gland, okay? The main reason why is it's sitting slightly more cranial than it should, whereas the left adrenal gland in a dog is gonna be more medial. But if we slow this down and use our landmarks more specifically our aorta and our left renal artery, we are able to pinpoint and find our left adrenal gland more readily. So we have our aorta here. This, what I'm suggesting is the lymph node, and as we scroll back through, we see this structure right here, which is the cranial pole, and here's our caudal pole of our left adrenal gland. And what I'm seeing run through it is your phrenicoabdominal vein, which gives you the classic confirmation that this is left adrenal gland. And then here, caudal to it, is our left renal artery. So, left adrenal gland, nearby periaortic lymph node, and left renal artery. So using your anatomy is very important because you do get lymph nodes that can be in this area that look like adrenal gland, phrenicoabdominal vein, and your left renal artery adjacent to your aorta.